Hello friends, welcome to the healthcare today. Today we are going to discuss about asthma. What is the common misnomers about asthma? How is it affecting us and how is it treated? So asthma is a genetic disease which is characterized by allergy. Now depending upon your organ of involvement, we term allergy as different parts. For example, if you are having an allergy of skin, we call it allergic dermatitis. Similarly, if you have allergy of nose, where you can see the continuous discharge from nose or blockage of nose, you call it allergic rhinitis. Similarly, for eyes, you call it allergic conjunctivitis. Similarly, for throat, you call it allergic pharyngitis. Similarly, for lungs, when the airway is involved, you call it allergic bronchitis or also called as asthma. So once you say asthma, most patients often panic. So doctors find a convenient term to say that it is bronchitis. The second thing is, most asthmatics, around 90% of the asthmatics, doesn't require medication round the clock. They doesn't require medication throughout the year. 90% of the people who are diagnosed with asthma will require medication only once there is change of weather, whether it is winter to summer or summer to winter. These patients require medication for 2 to 4 weeks, not more than that. Remaining 10%, out of which 5 to 7% which are called persistent asthma, they require inhaler on a regular basis, maybe once in the evening and once in the morning, and at times they may have an exacerbation requiring some oral medications. But only 1 to 3% of patients who are called severe asthmatic patients, they require round the clock medicines. Few of these patients might require newer medications which are called biologics. I'll explain to you regarding that in the later part. Now, once what is asthma? How does it present? So once you are having allergic symptoms, what we most commonly see is patients complain of chest tightness. They say that something is stuck here. You find cough with sticky expectoration, some fever, and few patients wheeze. So this happens because once you are in contact with an allergen, your body responds to the allergen. So allergen enters your airway, then there is an inflammatory metal which happens. There is some inflammatory edema which comes, thereby leading to constriction of the airway. Earlier the airway is very free, where oxygen can freely pass. But now the airway is constricted, that's why you find whistling sounds, which are characteristically called wheezing. Once you find wheezing, and once you have chest tightness and cough with expectoration, and if you go to a physician, your diagnosis is almost confirmed that it is asthma. But at times patients do present late. Sometimes most of these symptoms must be missing. Then the physician or a pulmonologist asks you to do a pulmonary function test. There is a computer where you blow through it, which exactly tells your lung function. Once we identify that your lung function is on the lower side, we give you a medicine which will help you to dilate the bronchus diameter. Once there is dilation, after 15 minutes the test is repeated. Now earlier you find some values. Now after doing the test, after taking medication, the values you found will be increasing. So this is called reversibility. That means your airway is responding to the medicine which we have given. So to confirm asthma, either you have these symptoms or you have a PFT which says that there is an obstruction with reversibility. So this is the characteristic definition of asthma. As I told you, asthma is a reversible disease. If you take inhaler regularly, it is completely reversed. Okay, and the primary cause is genetic. You get these genes from your grandparents or somewhere else, where there is one gene which will lead to asthma or other allergic symptoms. Depending upon the organ involvement, you may have coexisting other symptoms. Most common cases you can see nose as well as lung involvement, which we call it as nasobronchial allergy. Now once you are diagnosed with asthma, how do we treat? The treatment is very simple. The treatment is inhalers. We all know most patients do panic once we mention that inhalers are required. Once patients is placed on inhaler, there is a common misnomer that patient becomes dependent on inhaler. It is not the case. If you see, for any medicine, we have 3 or 4 treatment options. One is IV medication, oral medication, nebulization, and inhalers. IV doses are in milligrams. It is 100 milligrams, 200 milligrams. In tablets, it is 5 milligram, 10 milligram. Inhalers, it is 400 micrograms. If you see, it is very clear that the inhaler dosing is in micrograms and it directly acts on the organ affected. In case of skin, if there is a skin problem, you apply ointment because it is directly in contact with the abnormal area, so that you find maximum relief. Similarly with the eye, you use eye drops. Similarly with asthma, you use inhalers because it is directly acting and it is the lowest dose possible, which makes you alright. So leave this misnomer that once you start a patient on inhalers, they are bound to take it. No, that is not the case. 90% of the cases, as I told, they require inhalers only for short term, 2 to 4 weeks. Once the patient is better, we will try to taper off the medicines, which is called step down approach. As initially, if the problem is very high, we try to give you oral medicines as well. Once your response is good, we cut down the oral medications. Then we will start cutting down your inhaler dose. For example, in earlier, if you start with 400 micrograms, we make it 200. Then we make it 100. So that's how we step down the therapy. So once you are better, we can always stop your inhalers. But there are few cases where we require inhalers for a long term. These cases are called persistent asthma cases. So these cases, they may occur for longer duration. Once they are better, you can stop the inhaler again. But few cases, 1 to 3% of the cases, in spite of giving inhalers, in spite of giving oral therapy, and in spite of giving oral steroids also, these patients continue to wheeze, limiting their daily activities. They cannot walk, they cannot do their routine activities. In these cases, if we do further assessment, we do the phenotyping of asthma. Once we find out that these patients have certain other characteristics like increased eosinophils or having significant allergic load, then we have biologic medications which are fairly new to the market. They are available as once in 15 days or once a month injections, which will give you absolute relief. So as I told you, once you are diagnosed with asthma, it is always better to consult a physician or a pulmonologist who will guide you regarding the inhaler therapy, and always use the right inhaler technique so that you will find the maximum benefit from the inhaler. So once you do these things, asthma is absolutely controllable, and you will not have any limitation in doing your daily routine work. With this, whenever you have these symptoms, please visit the pulmonologist who can guide you, who can diagnose you clinically or using a PFT. But once you are started on therapy, it is always imperative on your side that you know when to step up the therapy or when to step down the therapy. We care about you.